Right. We're talking about the last of the muscles of the rotator cuff, which is the subscapularis. Now, this is actually the biggest of the four muscles. So the way you access this muscle is by abducting the arm, and you feel for the free edge of the scapula, because this sits in front, anterior to the scapula, and runs backward, tucking between the scapula and the ribs. So I'm feeling for the free edge, and you can find it, and I'm going to draw it. Starts from the posterior fold of the axilla here and runs down there, and that's the end of the scapula, just here. Okay, and this muscle is running inwards, and if I pinch, you've got the latissimus dorsi at the back, and this muscle is in here, and it runs deep inside, runs forward over the scapula, and it comes and joins into the front of the humerus there. So this muscle is the only muscle that comes to the front of the humerus, and it forms the anterior part of the rotator cuff. The other three muscles wrap around, the supraspinatus over the top, infraspinatus and the teres minor around the back. The subscapularis comes around the front. So what I've drawn here is how the subscapularis tendon comes in and joins, wraps around the rotator cuff here, but the triggers live in here. So the first trigger, you feel the free edge of the scapula along here, you feel the latissimus dorsi at the back, and you tuck your finger in and you dig, and now is that tender?
A little bit.
Okay, and then so the first is high, the second is slightly lower, and the third, quite frankly, is non-gettable. It's drawn in the Travell and Simon's book as right on the other side of the scapula. I would imagine that you could get there in a person who was very, very mobile, but I don't look for it because I would probably lose a friend digging in as hard as I would need to get there. So I practically have two. The one is here and the one is there. These are the two triggers. Okay, these are the two triggers. There and there. And you can feel first, second. Now, the treatment is the same, always the same principles. So, the subscapularis, when it contracts, will internally rotate and adduct your arm. So therefore, when you have active trigger points in the subscapularis, the movement you lose is external rotation and abduction. Now this is very interesting because loss of external rotation is something that normally does not occur with rotator cuff problems. And this occurs in all the textbooks, and as I described before, when you have loss of external rotation, usually it means that there's a frozen shoulder. So in the Travell and Simon's book, the original and the second edition, the little name that they give for the trigger points in the subscapularis is that it is the muscle that creates the illusion that you have a frozen shoulder. It's not. So therefore, to get in there can sometimes be really quite difficult. And abduction is normally a little easier than external rotation, which tends to stretch the muscle more. So you would just gently bring the person's arm up as far as it'll come. You then dig in underneath So I'm going to lift it up higher so that everyone can see. Find the trigger, search for it. If it's there, it is excruciating. You do not need to press hard at all. The person is already tensing against you. So often I'm just letting the arm relax down onto my hands tucked into the axilla, and I'm feeling the muscle fibers are running in this direction. So I'm feeling that way, 90 degrees to the muscle fibers, and I find the trigger point, and again I'm watching really carefully because you'd be super uncomfortable. You relax, you breathe, you take the tension off, and you start pushing, and you do the same thing for ischemic compression. You press just firmly enough, and then gradually we increase the pressure. Treat the other trigger, treat both triggers. Cold under the arm is kind of cruel, but it's surprisingly effective. Again, I would start just here, and I would run like that. The pain zone, fascinatingly, even though the muscle comes to the front, the pain zone is mainly over the back of the shoulder. It's about this big, and so if you turn around slightly, this is the pain zone here. So what I'd do is I'd run like this, over here, and underneath and up into the pain zone. Down, under, like that, and then into the pain zone. And then the stretching out is actually quite important, because what tends to happen is because the muscle is strong and it goes into spasm, so I would just gently stretch it out. Normally abduction is easier. I would run the cold, and I would do a second pass. Then I would gently go into external rotation if possible. Then I would do some more runs, and then I would gently move up and up and up until you're like that, where what you have, the subscapularis stretched out fully. We'd apply a heat pack from here right around, like that. Leave it on for a while, and then again, that stretch. Gentle abduction, external rotation, elevation, slowly up until it's right up behind here. And then you've really stretched out, and you have completely changed the function of the shoulder and the pain, because the pain is an intense pain that you get with subscapularis triggers. So, difficult to get to muscle, absolutely worth the effort.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.